Hey, Adam,
Geez,
one
why,
thing.
why do you think they called bumpers, Gary?
I don't know.
Because they come at the beginning, at the end, like bumpers.
Alex, you're a marketing guy. Do you like that design behind Paul? Does that SWOT logo thing look pretty cool to you?
Hey, I forgot to hit the record button.
Yeah, that's really professional, isn't it?
Well, this is a professional podcast.
I met her in a parking lot and was handed 2 little Yorkies. And the only person I knew that knew Yorkies was Paul. So I called Paul and said, Paul.
Sweet Talk is a weekly 20-minute podcast brought to you by the Continuing Education and Workforce Training Division of Idaho State University's College of Technology. Find us on Apple Podcast, Spotify, and SoundCloud and subscribe today. Now it's time to get started with Sweet Talk.
Hello, everyone. Welcome back to Sweet Talk, a weekly podcast here at Idaho State University's Continuing Education and Workforce Training. I am one of your hosts, Paul Dickey, the Video Instruction Manager and Apprenticeship Coordinator here at SWEET. And as always, joining me is my co-host, Angie Wilhelm, our Marketing Director. Angie, how are you today?
I'm doing really well today. Thank you, Paul. As well as myself and Paul, we have Raylyn Price, the Interim Director of SWEET, co-hosting as well. How are you, Raylyn?
I am doing well. I've got a little frog in my throat, but beyond that, I'm feeling good, looking good, maybe. Looking like my throat's not croaky. So yeah, we're doing good.
Excellent.
And we have with us here one of my favorite student interns. Her name is Lexi Campbell, and we're so happy to have Lexi Campbell here. We brought her here because she is a current member and a former vice president of the dental club, the pre-dental club here on campus. But I just want to introduce Lex a little bit. She came to us last fall as a CPI here on campus, career path intern for the health programs. And she has been amazing. She has used her background in as a dental assistant, and then now as in her pre-dental to help us out in the dental program, our dental assisting program. She's helped in the clinical setting. She's helped build course work and activities, and helped us build actually our new addition for our dental assisting program, as well as work with CNA, phlebotomy, CPR, anything health related. She has helped us out. She has become kind of our H5P expert and Moodle expert in helping us to build out these classes. So we really love and appreciate Lexi. But that's not why she's here. She's here to tell us about the pre-dental club. So I'll let Angie take over.
So welcome, Lexi. We're very excited to have you today. Can you take a few minutes to introduce yourself and tell us a little bit about the pre-dental club?
Sure. So my name is Lexi Campbell. I am a senior here at ISU. This is my last semester. I graduate in 2 weeks, so I'm almost there. We're almost done.
We are so sad. We are so sad.
We are.
I'm trying to be sad for you, but I'm not sad. I'm so ready, I think, to be done. But yeah, so I am a pre-dental student. I'm preparing to go to dental school. And the club that I was a part of, am a part of, the pre-dental club really is just a way that we as students can help each other prepare for dental school. It's a long list of to-dos, and it's a lot of stuff that we have to do. And it feels really kind of alienating when you're the only one doing it. And so the goal of the pre-dental club is that we can get together and have somebody else to like bounce ideas off of and find opportunities with to prepare for dental school.
So what's the best advice that you've had so far through the dental club that's helped you the most?
Probably start early. If you're a junior or even a sophomore and you start thinking, wow, what do I need to do to prepare for dental school? You're already kind of on the back foot. And that doesn't mean you can't do it. I started preparing it my sophomore year, but it's harder when you wait.
So I have a question for you, Lexi. Obviously, you're in our office, so we've gotten to know you a little bit better than someone that we're just bringing in. I had a really interesting conversation with you a few days ago regarding how the dental club has helped you specifically. Can you talk a little bit about how that has assisted you in knowing kind of what to do to get into dental school?
Yeah. A really big thing that the pre-dental club has done for me is it kind of has connected me to previous members of the dental club, the ones who have already applied and are already applying. So even this cycle, it's been really helpful to like see my friends who have applied this last time and talk to them about their experiences and how their interviews have gone and what they wish they had done differently and be able to compare that. And there are people who applied like 3 years ago and who are at dental school still reach back to our club and answer our questions. So it's really the most valuable thing to me is having someone to ask your questions to.
So, Lexi, you say that they help you prepare for dental school. What do you mean? What do you have to do to prepare for dental school?
Right. There's a long list of things. So like the main things we all think about is like the prereqs. You got to get those prereqs done. And so knowing what who the rest professors to take, that helps a lot. But also you need about 100 hours of job shadowing time to make your application competitive. And it's hard to know. There are a lot of dentists in Pocatello, but it's hard to know which ones would be willing to have a student follow them around all day, and which ones would like provide a good like learning opportunity for you while you're there. So that's another big thing. And another big thing is preparing to take the dental admission test, which is this really huge 6 hour long exam that covers like organic chemistry, math, biology, all these topics, just to kind of prove, I think just to prove that you're smart, that you can do this. And having somebody tell you like what resources are out there to help you prepare for the DAP also helps.
So does the dental club also act as a study group, or is it just to let you know where the resources are to help you study for the test?
A little bit of both. So right now, our current president, our previous president, and our current president set up a Gen Chem OChem study group that's kind of outside of the club meetings. So when we're all there together meeting as a club, it's nice to be able to connect with each other and make study groups outside of the club to do those things with.
That's great. So do you have an advisor who is a dentist or from the dental field to kind of help to guide you?
We have an advisor from the university who helps us with a lot of stuff. It would be really cool if we could have one from the dental field. But Dr. Weibargen, actually from the IDEP program, he's been super helpful and he's always willing to answer our questions as well, which has been nice.
That's awesome. So as you have done your shadowing, have you found something that you love in the field of dentistry? Like,
I thought I wanted to be an orthodontist before I did a lot of shadowing. And then I shadowed some orthodontists and I shadowed some general dentists. And I was like, I don't think orthodontist stuff is for me. I think I would rather fill cavities and do root canals than put on braces. And so that was a big change in my path. I thought I was so sure that I wanted to be an orthodontist, but now I'm pretty certain that's not it.
okay.
And I had an experience a couple of years ago where I shadowed an endodontist and an oral surgeon, and I've never gotten nauseous at the sight of blood, but that time I did. So I know I don't want to be an oral surgeon.
Now, I have a couple questions. This is a twofold question. One, what types of majors would you advise students to take that are looking at going into dentistry? And the second part is, you've been working here at Continuing Education, and we have a dental assisting program. So have you been involved in that? And if so, how so?
Right. As far as majors, you can technically major in anything as long as you get your prerequisites done. I know a lot of medical schools, they care what you major in, but dental schools don't really care as long as your prereqs are done. So I chose a major that would help me get those prereqs done as easily as possible. So I majored in health science, but you could also major in biology or chemistry or biomedical sciences. And then this job has been super awesome for me. Even just being able to like put it on my little application, just because I've been able to be so involved in the dental assisting program. I'm there for about half of their clinicals, showing them how to do dental assisting stuff and like teaching the skills. And that's really how a lot of our first year dental skills will be those dental assisting skills that I already know and have been able to practice by teaching them. So
that's awesome. I'm glad that it was such a good fit, you
Yeah.
know, for you to come and to help out on office, but then also that because you were a dental assistant and had that background, you were able to add so much to clinicals. So it's amazing. Yeah.
And it's helped me to help out in clinical. It's helped me to think more deeply about why we do the things we do in dentistry. As an assistant, you can get kind of in the mindset you do it because you do it. But when you're in a clinical setting and the student says, well, why do we do it? And having to know the answer, that I think has helped me to think more critically about things.
So, Lexi, on the pre-dental club, is it just academic assistance, or is there some social bond that you do in the club as well? I mean, do you do activities together?
We went bowling a couple weeks ago, which was a lot of fun. So yeah, we're pretty social. We get together quite a bit. I think we're just a good fit for each other, because we have the same niche interests. But then also when you spend that much time studying with each other and working out like who's gonna do what, trying to get service hours together and that kind of thing, yeah, I think you end up becoming pretty close friends. So
That's amazing.
So what are your plans for the future? Like I know you talked about not wanting to do oral surgery or orthodontics, but like where is Lexi going to be in 10 years?
right. I want to be a general dentist. I know that, and I think I want to own my own practice. I think I would really like to experience that, like the business ownership side. That's the part I'm the most scared of. I feel like I can learn how to be a dentist. I'm not sure if I can learn how to be a business owner, but I'd like to try. And I think I would like to have like a smaller office where I can kind of be a part of everything, keep everything. I guess just like do it all myself a little bit and explore everything that there is to do with being a dentist. So
That's awesome. Do you see yourself in a small town or a big town or a big metropolitan? Like,
I think I could live anywhere and be happy is what I've learned. I've lived in Pocatello for a while now, but before that I kind of lived all over the place. So I think I could live anywhere and be pretty happy.
so wherever you're like planted, that's where you'll grow into this wonderful dentist.
I hope so, yeah.
So what is the need for dentists nationwide? Do you have any statistics on that?
So I know it's definitely growing. Like a lot of healthcare occupations, of course, are growing because we're needing more and more care, and as the older population is growing, we need more care there as well. So dentists are definitely a big need to kind of fill that need. People need people who are able to have these skills to fill cavities and make dentures and keep us all healthy. So
How
it's
about
definitely a growing
women?
field.
How about women in the dental field? What is the kind of the ratio? I know we had a woman dentist here. Well, I think she still does practice here, but they're far and few between.
Right. Yeah, I think there's one woman dentist in Pocatello, which is bizarre to me. And maybe it's just an Idaho thing because 52% of dental school graduates today are women.
Oh,
So,
Oh, wow.
whoa.
Excellent.
so we're definitely not the minority so much anymore in the field, but it might take a few years before we start seeing that like in practice as
So,
well.
Lexi, why dentistry?
Hmm. Initially, I really, really liked dentistry because I thought teeth were super cool. I just thought it was like the most wild thing. I remember when I was 8, my dad took me to the dental school. We lived in Las Vegas at the time at UCLA, and he took me to the dental school to get some work done. And I remember like looking around and thinking all these tools, like they had just the suction I thought was the coolest tool in the entire world. Like it's like a tiny little vacuum for your mouth. And I was blown away. I thought it was the coolest thing in the entire world. And so one of the dental students gave me just a face mask and some rubber gloves, and I went home and tried to stick my fingers in my brother's mouth, and he, of course, was not having it. But ever since then, like my reasons have shifted and grown, but I think that was the start, was
Wow. So
having that time.
So you actually, this is kind of like one of those times where from a kid, this is something that you've always wanted to do.
Mhm.
because
Yeah.
everyone is going, I'm going to be a fireman. And that's when you're a little kid, you have these aspirations, but as you grow and you develop as an adult, you kind of leave those a lot of times those. But it sounds like this is something that you started and you've always wanted to do.
Yeah, yeah, for sure. Which makes it a little hard to talk about. In dental school interviews, they ask you like, "What's your deep reason?" And I'm like, "Well, I started wanting to do it, and I never stopped."
Yes.
So I feel like maybe I need to workshop that interview answer a little bit.
That's
So what is one of the most rewarding things about the dentistry industry that you've discovered so far? And also follow up, what's some of the most difficult things that you've discovered about the dentist industry so far, as you've been pursuing this career path?
I think the most rewarding thing is helping people kind of overcome their anxiety around dental care. It's a lot of people are really afraid of the dentist, and they should be. A lot of them have had really, really bad experiences. And so like, I get why it's scary, and I would just love to change that culture around dentistry so that it's not a scary thing where people feel like they can like converse and talk to their provider and say like, hey, I'm in pain, or hey, this thing feels wrong, and be listened to and be like heard. And so when I'm able to do that as a dental assistant, that's been really, really helpful for me to see my future in this more, um, knowing that I can help people just to feel comfortable getting this care that they need. And so we can stop hearing people say, well, it's been 10 years since I went to the dentist because I hate it and I'm too scared. I don't want anyone to have to feel that way in my chair. So,
yeah, that's
And do you want to focus on adults or children or both?
adults. I'm really afraid of getting bit.
Is that a common occurrence?
I've only been bit once and it was an adult who bit me.
Wow.
I'm not sure, but I've heard in peds you do get bit a lot, but it's not hard. It just happens a lot.
Wow. Um,
Or
I,
maybe
you
that's
know,
just my own fear.
so so on this path to becoming a dentist, have you already taken the dental hygienist program, or is that something that you don't even go into? You go from your degree program right into the dental program.
So it's typical to go from degree right to dental. You can take a pit stop at dental hygiene, but you're going to learn all of those skills in dental school anyway. So I chose not to do dental hygiene, but you could.
Okay, all right. So I don't know how difficult it is. It sounds like you said you have to take a 6-hour test to get into it, but what's kind of the ratio of acceptance? I mean, is it competitive to get into the dental program?
I'm not sure. I don't have any numbers on that, but it feels competitive. It feels impossible sometimes. But I know like it's not uncommon to have to apply a few cycles or to keep trying. Um, and it's definitely they expect a lot of you. They expect you to have really good grades and to have done really well thus far and to be able to prove that you can do this because dental school, often your credit load is upwards of 20 credits at a time. You're in class itself for 40 hours a week and then clinical all during your free time. It's a big commitment. And I think the dental schools, they want to see that you have already put in that work and you're willing to, as it ramps up, to keep putting in that work.
I
So what are
imagine,
your go ahead, Paul.
well, then I would imagine that being in the pre-dental club is a kind of a bonding experience because you're all having the same type of workload and stress, and you can share that with other people.
Yeah, the pre-dental club has been really great for that for sure.
So what's your dream dental school? Do you have one?
I would really like to get into the Idaho Dental Education Program, which would take me through Creighton University. It's basically a program that the state subsidizes. They'll pay the difference between in-state and out-of-state tuition for you to go to Creighton in Nebraska. But your first year of dental school actually gets to be here at ISU, which I would love to do just to get to stay here for a little while longer as well.
Yeah, that would be amazing. Do you know what is the acceptance rate like that from ISU grads?
I know statewide they usually accept around 8 to 10 students every cycle for that program.
Yeah. Sounds like a lot until you apply, right?
Yeah. It's hard to think, well, am I the 9th best in the state? I don't know about that.
Wow.
So,
Yeah.
but
Well, we are running out of time. We only have about 1 minute and 30 seconds left. Lexi, can you, if someone is interested in getting into the dental club, the pre-dental club, to assist them with their journey to becoming a dentist, who would they reach out to and how would they do that?
Right. So our current president is Eric Barney. He's doing a great job. They've got a lot of cool stuff coming up next semester that I wish I would be around to be a part of. But you can email him at predental@isu.edu. And they'll answer any of your questions, or contact Maya Tillotson from academic advising, and she can help you with that as well.
Excellent.
So we also have an Instagram that's a new and exciting. So
Really? What do you
Yeah.
post on your Instagram?
Teeth. No, mostly it's for events and stuff, so that everyone in
Okay.
the club is all on the same page.
So I have to admit something. You know, I was one of those people that was afraid of the dentist until I met this one gentleman in Groton, Mass. I had to have a root canal, and he promised me, Paul, I promise you won't feel a thing.
Wow.
4 hours in the chair. And after that, I just my attitude completely changed. And I was like, no, teeth are like the most important thing. Now, you haven't done a lot of. Have you seen a lot of patients? Have you come across this a lot where people are so afraid and they have apprehensions about being at the dentist?
Yeah, I've seen quite a lot of it, quite a bit. And I feel that too, definitely myself. I'm always like, I don't want to go. So I don't want to be in the chair. I want to be on the other side. Yeah.
Well, I really appreciate you being on today. I did not know about the club, and it sounds like a wonderful opportunity to meet with your peers and also share your shared experiences as you go through the program. And thank you so much for being on today.
Of course, yeah. And I just want to say, for like people who are listening, if they're thinking they maybe want to do dentistry and they feel like maybe they're not smart enough or they can't do it, to think that maybe you can. I feel like a lot of people have told me in the past, like, well, I just couldn't do it. I'm not good enough for that. And you just don't know until you try. So I don't want anyone hearing this to feel scared or nervous that they can't do it, because I think people are way more capable than they think they are, and they can do these hard things and reach these goals.
That's great. Perfect.
Well, I think that's going to wrap it up for today. Thank you again, Lexi, for being on. Raylyn, as always, thank you so much for joining us on these podcasts. Angie, I cannot do this without you. But if anyone wants to check out our offerings, they can go to our website at cetrain.isu.edu, or you can email us at cetrain@isu.edu, or give us a call at 208-282-3372. And if you like this podcast, please like, share, subscribe. It's a nice community podcast, and we want to share our message with as many people as possible, and we would appreciate that if you would help us out. And be safe out there.